Oncology Helicopter Overview Module 3. In Module 1, Oncology Basics, we've discussed the following topics: Introduction, Cancer Definition, Cancer Hallmarks, Abnormal Proliferative or Proliferative Growth Factor, Genes involved in cancer, Two-hit hypothesis, Carcinogens, Cancer grading and staging, Cancer management. In Module 2, Chemotherapy classification and the principles, we have discussed the following topics: Cancer management, Principles of chemotherapy, Cell cycle review, Chemotherapy treatment types. In Module 3, Understanding Cell cycle non-specific chemotherapy mechanism of action, we will discuss the Alkylating Agents mechanism of action, Platinum compound mechanism of action, and the mechanism of action of the Anticancer Antibiotics. Chemotherapy classification, antimetabolites or S-phase specific, monoclonal antibodies, microtubule inhibitors, M-phase specific, Topoisomerase inhibitors or S-phase specific, cell cycle non-specific or CCNS, such as alkylating agent, anti-tumor antibiotics, and platinum agents, or hormonal therapies. To fully understand the cell cycle non-specific alkylating agents, we should have a little bit deep diving and knowing some pivotal definitions such as the genome, which is the entire set of DNA instructions found in a cell. In humans, the genome consists of 23 pairs of chromosomes located in the cell's nucleus, as well as a small chromosome in the cell's mitochondria. A genome contains all the information needed for an individual to develop and function. DNA replication, which is copied in cells. Before a cell divides, it must first copy or replicate, as you can see, its entire genome so that each resulting daughter cell ends up with its own complete genome. Transcription. It involves copying a gene's DNA sequence to make an RNA molecule. The transcription is performed by enzymes called RNA polymerases, which link nucleotides to form an RNA strand using a DNA strand as a template. The RNA ribonucleic acid is a nucleic acid present in all living cells that has structural similarities to DNA. Unlike DNA, however, RNA is most often single-stranded. There are three main types of RNA. Messenger RNA or mRNA. It provides the template for protein synthesis during translation. tRNA, transfer RNA, it brings amino acids and reads the genetic code during translation. Ribosomal RNA, rRNA, it plays a structural and catalytic role during translation. The translation process is a process by which the genetic code contained within a messenger RNA or mRNA molecule is coded and interpreted or converted to produce a specific sequence of amino acids in a polypeptide chain to finally form a specific protein. As illustrated here in the graph, the DNA is transferred to mRNA by transcription process. After that, the protein will be formed through the translation process. Now we're gonna explain what central dogma is a process in which the genetic information flows from DNA to RNA to make a functional product protein. As you can see in the graph, replication happens to DNA. RNA is generated by the transcription process using DNA as a template. DNA synthesis can also be done using RNA as a template by a process called reverse transcription. Finally, the ultimate goal of creating a protein is achieved by using the genetic code contained within a messenger RNA or mRNA molecule, which is decoded to produce a specific sequence of amino acids in the polypeptide chain to finally form a specific protein. We are still discussing the introduction of basics and the pivotal definition to fully understand the cell cycle non-specific alkylating agents, such as what DNA Adduct is. DNA Adduct is a piece of DNA covalently bonds to a chemical moiety such as safrole, benzopyrene diol epoxide, acetaldehyde. It gets damaged, resulting in abnormal replication. This process could be the start of cancerous cell when a chemical binds to DNA. That's why we should here notice and mention that alkylating agents increase the risk of leukemia almost 5-fold, but that risk increases to almost 24-fold in patients receiving the highest doses. Doxorubicin, together with high-dose alkylating agents, increases that risk further. The alkylating agents, topoisomerase 2 agents, and anthracyclines are chemotherapy agents reported to be carcinogenic. To make the idea of DNA Adduct a crystal clear notion, it is easily elucidated here in the graph explaining cisplatin-induced DNA adducts. Cisplatin, which is an alkylating agent, is covalently bound with guanine nucleotide base in only a single strand of DNA to form single purine adduct. Intrastrand crosslink is formed when cisplatin covalently bonds with 2 guanine in only one strand of the DNA. The interstrand crosslink can be formed if cisplatin covalently bonds with 2 guanine at the 2 strand of the DNA. In this slide, we're gonna know what alkylation process is, where it happens, and how it happens. The alkylation process is a chemical reaction that entails transfer of an alkyl group. Nucleophilic sites describes the affinity of a nucleophile to bond with positively charged atomic nuclei. Where it happens, DNA alkylation or adduct formation occurs at nucleophilic sites in DNA, mainly the N7 position of guanine. Ever since identification of the first N7 guanine adduct, several hundred studies on DNA adducts have been reported. Alkylating agents are small molecules that can covalently bind an alkyl group to electron-rich nucleophilic moieties and exert cytotoxic effect. As you can see in the guanine structure, N7 and O6 positions have negative charges because it is electron-rich sites, which represents the nucleophile sites, and the alkyl groups, which is positively charged, and as a result of that, it favors to bind with N7 or O6 in the guanine nucleotide base. The alkylating agents. The primary mode of action for most alkylating drugs is via cross-linking of DNA strands. They can be classified as either monofunctional alkylating agents, implying reactions with only one strand of DNA, or bifunctional alkylating agents, which cross-link 2 strands of DNA. What does cross-linking of DNA mean? In genetics occurs when various exogenous or endogenous agents react with 2 nucleotides of DNA, forming a covalent linkage between them. This cross-link can occur with the same strand, intrastrand, or between opposite strands of double-stranded DNA, interstrand. These adducts interfere with cellular metabolism, such as DNA replication and transcription, and triggering cell death. What hematopoiesis is? It is the formation of blood cellular components, occurs during embryonic development and throughout adulthood to produce and replenish the blood system. Studying hematopoiesis can help scientists and clinicians to understand better the process behind blood disorders and cancers. As illustrated in the picture here, hematopoietic stem cells are multipotent primitive cells that can develop into all types of blood cells, including lymphoid lineage cells, which can differentiate to produce beta lymphocyte, T lymphocyte, or even natural killer cells, and myeloid lineage, which can differentiate to produce erythrocyte, platelet, basophil, eosinophil, neutrophil, and monocyte types of cells. Now we're gonna talk about the first 2 members of the cell cycle non-specific alkylating agents. In this presentation, we're gonna try to completely understand the mechanism of action of 21 alkylating agents and its related compounds such as stromastine and altritamine. Mechanism of action of busulfan. It is an alkylating agent which reacts with N7 position of guanosine and interferes with DNA replication and transcription of DNA, has a more marked effect on myeloid cells than on lymphoid cells, and is also very toxic to hematopoietic cells. Busulfan exhibits little immunosuppressive activity. It interferes with the normal function of DNA by alkylation and cross-linking the strands of DNA. Mechanism of action of trisulfan. Trisulfan is a bifunctional alkylating agent prodrug with cytotoxic activity in hematopoietic stem cells. It undergoes spontaneous pH-dependent conversion into monoepoxide intermediate and diepoxybutane. Epoxides alkylate and cross-link DNA and are considered responsible for the stem cell depleting, immune suppressive, and anti-neoplastic effects of trisulfan. What carbamylation is? It is a post-translational modification resulting from the non-enzymatic reaction between isocyanic acid and the free functional groups of proteins. This reaction alters structural and functional properties of proteins and results in faster aging of proteins. Post-translational modification, or PTM, is a process of covalently adding a chemical group to an amino acid in a protein after the protein has been synthesized. As you can see, here is the chemical structure of isocyanic acid. Here is the chemical structure of nitrogen mustard. The nitrogen mustard was the basis for the synthesis of a large series of clinically useful derivatives, including melphalan and cyclophosphamide, all found to exert their anti-tumor effects by alkylation of DNA. The mechanism of action of carmustin or carmustin. It interferes with the normal function of DNA and RNA by alkylation and cross-linking the strands of DNA and RNA. Carmustin inhibits enzyme processes by carbamylation of amino acids in protein. Lomustine. It inhibits DNA, RNA, and protein synthesis via alkylation and carbamylation of DNA and RNA. Bendamustine. As depicted in the photo, carmustin and lomustine are two of the most extensively used nitrosurea compounds. These therapeutic agents are lipid-soluble and therefore capable of crossing the blood-brain barrier. Carmustin can be given as intravenous. Lomustine can be administered by oral route or route of administration. Bendamustine. It is an alkylating agent, nitrogen mustard derivative, with a benzimidazole ring, purine analog. As you can see here, the chemical structure of the benzimidazole ring, which demonstrates only partial cross-resistance in vitro with other alkylating agents. Bendamustine leads to cell death via single and double-strand DNA cross-linking. Bendamustine is active against quiescent and dividing cells. The primary cytotoxic activity of bendamustine is due to bendamustine as compared to its metabolites. When it comes to the estramustine, which is an estradiol and nor-nitrogen mustard carbamate-linked combination, which has anti-androgen effects due to estradiol, anti-microtubule effects due to nor-nitrogen mustard. Estramustine causes a marked decrease in plasma testosterone and an increase in estrogen levels. In this slide, we can do a little bit deep diving in estramustine mechanism of action to be fully understandable. Here is estramustine chemical structure. Estramustine, long misclassified as an alkylating agent, is a stable conjugate of an estradiol and nor-nitrogen mustard. Without any effort, we can observe the estradiol. Here is the chemical structure of carbamate, which can be easily noticed in the estramustine chemical structure. Carbamate-linked combination, which has anti-androgen effects due to estradiol. Without any effort, we can observe the estradiol structure in the estramustine chemical structure. Anti-microtubule effects due to nor-nitrogen mustard. As demonstrated here, we can effortlessly see the difference between the chemical structure of mustard gas, nitrogen mustard, and nor-nitrogen. Estramustine causes a marked decrease in plasma testosterone and an increase in estrogen levels. Binding of estramustine to microtubule-associated proteins, tubulin, and proteins of the nuclear matrix are presently considered to be the most likely mechanism underlying the cytotoxicity of estramustine in androgen-independent prostatic carcinoma. Nitrogen masters have been established for more than 60 years and have stood the test of time. They are powerful cytotoxic and lymphoablative agents and remain important today. Cyclophosphamide, Ifosfamide, melphalan, and chlorambucil all have their specific place in the clinical arena. Knowledge of properties of the nitrogen masters continues to expand, and more sophisticated analytical methods have allowed detailed interrogation of metabolic pathways of the oxazophosphorenes, cyclophosphamide and ifosfamide, which are a major influence on the balance between efficacy and toxicity. As a result, new oxazophosphorene derivatives have been developed in attempts to decrease toxicity while maintaining efficacy, but these have not always been successful. Nevertheless, glufosinamide, ifosfamide remains under clinical investigation. Cyclophosphamide is widely used as an anti-cancer drug and an immunosuppressant and for the mobilization of hematopoietic progenitor cells from the bone marrow into peripheral blood prior to bone marrow transplantation. For aplastic anemia, leukemia, and other malignancies. Stem cell mobilization is a process whereby stem cells are stimulated out of the bone marrow space, e.g. the hip bones and the chest bone, into the bloodstream so they are available for collection for future reinfusion. The cells are then preserved, frozen, and stored until the time of transplant. The oxazophosphorenes, including cyclophosphamide, ifosfamide, trufosfamide, represent an important group of therapeutic agents due to their substantial anti-tumor immunomodulating activity. Cyclophosphamide and ifosfamide, as these two oxazophosphorenes, are the most widely used alkylating agents. Both cyclophosphamide and ifosfamide are prodrugs that require activation by hepatic cytochrome P450, catalyzed for hydroxylation, yielding cytotoxic nitrogen mustard capable of reacting with DNA molecules to form crosslinks and lead to cell apoptosis and necrosis. The majority of anti-neoplastic effects of cyclophosphamide are due to phosphamide mustard formed from metabolism of the drug by liver enzymes like cytochrome B450. Leuokomia is the dose-limiting toxicity of cyclophosphamide, and neurotoxicity is the dose-limiting toxicity of ifosfamide when preventive measures are taken to reduce urotoxicity. Acrolein is excreted in the urine and irritates the bladder wall, causing various adverse effects from urinary frequency, urgency, pain, and nocturia to hemorrhagic cystitis. Resistance to oxazophosphorenes is poorly understood, although increased aldehyde dehydrogenase activity may be a significant factor. In this slide, we're gonna simplify the mechanism of action as much as we can for cyclophosphamide and ifosfamide. Let's get started. The cyclophosphamide is converted by hepatic cytochrome P450 to its metabolite called phosphoramide mustard plus acrolein. The active metabolite of phosphoramide mustard is reacting with DNA molecules to form crosslinks. DNA at guanine N7 position leads to cell apoptosis, which eventually leads to anti-neoplastic effects. When it comes to the acrolein, which is excreted in the urine and causes hemorrhagic cystitis. The ifosfamide is converted by hepatic cytochrome P450 to its active metabolite, which is called ifosfamide mustard plus acrolein, which is excreted in the urine and causes hemorrhagic cystitis. What chemoprotective or uroprotective mesna effect is? Uromitoxan or mesna, or even can be called sodium 2-mercaptoethane sulfonate. It is completely excreted in 4 hours if given intravenous and in 8 hours if given orally. The mesna is inactivated to dimesna, mesna disulfide in the bloodstream. Afterward, reactivated mesna concentrates in the bladder. Mesna easily detoxifies the cyclophosphamide and ifosfamide toxic metabolite acrolein. The acrolein stimulates the release of inflammatory mediators, interleukin-1, beta tumor necrosis alpha, and endogenous nitric oxide, including vascular dilatation, mucosal edema, capillary fragility, resulting in hemorrhagic cystitis. To summarize, in a nutshell, mesna plus acrolein leads to make mesna acts as a sulfhydryl donor that forms a conjugate bond with acrolein. MSNA finally inactivate acrolein to a non-toxic compounds preventing hemorrhagic cystitis. According to a comparative study between cyclophosphamide and ifosfamide, which published in May 1991 in a peer-reviewed oncology journal Williston Park, the ifosfamide is a newly available analog of cyclophosphamide in oxazophosphorine drug class. Cyclophosphamide has been marketed for 32 years, which means now around 60 years, and it remains a highly effective agent for a wide cross-section of malignancies. Ifosfamide has a similar spectrum of anti-tumor activity, but has different pharmacokinetics that could provide advantages in efficacy. Although ifosfamide has been substituted for cyclophosphamide in many therapeutic regimens, it has not been proven superior to cyclophosphamide in any cancer. The ifosfamide current use in non-investigational therapy is for metastatic testicular carcinoma and sarcomas. Ifosfamide has a disadvantageous toxicity spectrum compared to cyclophosphamide and a greater financial cost. For most malignancies responsive to an oxazophosphorine, the analog of choice will remain cyclophosphamide. We finally should also know some crucial information pertaining to cyclophosphamide and ifosfamide. When it comes to the cyclophosphamide, while oral and intravenous treatments delivery methods of cyclophosphamide have been shown to be equally effective, the intravenous route is thought to have less toxicity than oral administration. Cyclophosphamide is one of the most successful chemotherapeutics. Cyclophosphamide has proved to be safe and has revealed its many capabilities and versatilities of clinical uses. The cyclophosphamide is cell cycle non-specific alkylating agent that prevents cell division by cross-linking DNA strands and decreasing DNA synthesis. Cyclophosphamide has a potent immunosuppressive activity, and it is a prodrug that must be metabolized to active metabolites in the liver. When it comes to the ifosfamide, we should remember that the primary route of administration for ifosfamide is intravenous. The oral form had a bioavailability close to 100% but resulted in severe neurotoxicity, and since then, the administration route has switched to intravenous administration. The ifosfamide is emetogenic, hence anti-emetic are routinely prescribed to prevent chemotherapy-induced nausea and vomiting. Precipitation of ifosfamide-induced encephalopathy by a prepitant has been reported in the literature. Ifosfamide causes cross-linking of strands of DNA by binding the nucleic acids and the other intracellular structures, resulting in cell death, inhibits protein synthesis and DNA synthesis. In this slide, we will keep knowing more basic information and definitions related to alkylating agent to help us fully understand alkylating agents' mechanism of action. What does transmethylation mean? It is a biologically important organic chemical reaction in which a methyl group is transferred from one compound to another. We should remember also that the alkylating agents were among the first anti-cancer drugs and are the most commonly used agents in chemotherapeutic today. Act directly on DNA, causing cross-linking of DNA strands, abnormal base pairing, or DNA strand breaks, thus preventing the cell from dividing. Alkylating agents are generally considered to be cell cycle phase non-specific, meaning that they kill the cell in various and multiple phases of the cell cycle. Although alkylating agents may be used for most types of cancer, they are generally of greatest value in treating slow-growing cancers. Alkylating agents are not as effective on rapidly growing cells. Lorbenectedin is an alkylating agent and a selective inhibitor of oncogenic transcription, which binds preferentially to guanine residues. In the minor groove of DNA, this forms adducts and bends the DNA helix towards the major groove. Adduct formation affects the activities of DNA binding proteins, including some transcription factors and DNA repair pathways. Inhibition of oncogenic transcription results in tumor cell apoptosis. Chlorambucil is an alkylating agent that interferes with DNA replication and RNA transcription by alkylation and cross-linking the strands of DNA, inducing cell apoptosis. Procarbazine inhibits DNA, RNA, and protein synthesis by inhibiting transmethylation of methionine into transfer RNA. May also damage DNA directly through alkylation. In this slide, we're gonna know what carbonium ion looks like and how the active alkylating metabolite of temozolomide and the dacarbazine, which is called MTIC, works to finally cause apoptosis. As you can see, carbonium ion is any member of a class of organic molecules with positive charges localized at a carbon. And as you can see, the MTIC adds a methyl group to the O6 position on guanine. As a result of that, the O6 guanine prompts a thymine to be added during replication rather than a cytosine. Afterwards, the cell has only two options: the mismatch repair or the apoptosis is triggered, leading to cell death. In the next 3 slides, we're gonna demonstrate the mechanism of action of 9 extra alkylating agents out of the 21 alkylating agent in Module 3 Oncology Overview presentation. Let's get started. Mechlorethamine is a nitrogen-mastered alkylating agent which forms inter- and intra-strand DNA crosslinks, resulting in inhibition of DNA synthesis. The melphalan is a bifunctional alkylating agent which is a derivative of mechlorethamine that inhibits DNA and rRNA synthesis via formation of carbonium ions crosslink strands of DNA. Melphalan acts on both resting and rapidly dividing tumor cells. Melphalan causes alkylation by covalent bonding with nitrogen atoms in the DNA of the guanine molecule at the 7th position. When it comes to the melphalan flofenamide, which is a peptide drug conjugate that is highly lipophilic and is therefore rapidly and passively distributed into cells. Melphalan flofenamide enzymatically hydrolyzed to the alkylating agent melphalan. Melphalan flofenamide's anti-tumor activity involves cross-linking of DNA. It inhibits proliferation and induces apoptosis of hematopoietic and solid tumor cells. When combined with dexamethasone, melphalan flofenamide has demonstrated synergistic cytotoxicity in multiple myeloma cell lines, including melphalan-resistant and non-resistant cell lines. Temozolomide is a prodrug which is rapidly and non-enzymatically converted to the active alkylating metabolite MTIC, methyltrypsin 1, imidazole 4-carboxamide. This conversion is spontaneous, non-enzymatic, and occurs under physiologic conditions in all tissues to which it distributes. As we've mentioned before, the cytotoxic effects of MTIC are manifested through alkylation, methylation of DNA at the oxygen 6 and N7 guanine positions, which lead to DNA double-strand breaks and apoptosis. Dacarbazine or dimethyltriazinomidazole carboxamide, DTIC, is an alkylating agent which is converted to the active alkylating metabolite MTIC via the cytochrome P450 system. The cytotoxic effects of MTIC are manifested through alkylation, methylation of DNA at O6N7 guanine positions, which lead to DNA double-strand breaks and apoptosis. Procarbazine inhibits DNA, RNA, and protein synthesis by inhibiting transmethylation of methionine into transfer RNA. May also damage DNA directly through alkylation. As demonstrated in the picture, temozolomide can be administered orally, while dacarbazine can be administered intravenously. Metabolites appear in urine for both temozolomide and dacarbazine. Temozolomide crosses the blood-brain barrier. Mechanism of action of streptozotocin. It inhibits DNA synthesis by alkylation and cross-linking the strands of DNA, and by possible protein modification. Thiotepa. Mechanism of action of thiotepa. It is an alkylating agent while produces cross-linking of DNA strands, leading to inhibition of DNA and RNA and protein synthesis. Alkylating. It structurally resembles alkylating agents, although has demonstrated activity in tumors resistant to classic alkylating agents. The cytotoxic effect of alkylating not fully characterized. However, it is likely that after activation, metabolites form crosslinks with DNA and RNA and inhibit DNA and RNA synthesis. Alkylating has demonstrated more activity in platinum-sensitive ovarian cancers than platinum-resistant disease. Now we're gonna basically discuss the last part of alkylating agent, which is called platinum compounds, cell cycle non-specific anti-cancer agents. First of all, we should remember the chemical structure of cis and trans as in the picture. Cis isomers contain functional groups on the same side of the carbon chain, whereas the functional groups are on opposite sides in the trans isomers. As you can see, the chemical structure of cisplatin approved from US FDA in 1979 as the first platinum compound getting US FDA approval. In 1989, carboplatin has been approved as the second platinum compound. The third one is oxaliplatin, which got its approval in 2002. According to Multidisciplinary Digital Publishing Institute, the platinum compound is considered as a milestone in the development of chemotherapeutic protocols for tumor treatment. The platinum derivatives cisplatin, carboplatin, oxaliplatin are clinically approved worldwide, and nearly half of all chemotherapeutic protocols for cancer treatment contain platinum derivatives. In 1978, cisplatin was the first platinum drug approved by Food and Drug Administration for the treatment of testicular cancer and advanced ovarian and bladder cancer. Cisplatin is still an important component of combination therapy of solid tumors such as bladder, cervical, ovarian, lung, gastric, breast, and head and neck cancers. Mechanism of action of cell cycle non-specific alkylating platinum compound. Carboplatin is a platinum compound alkylating agent which covalently binds to DNA, interferes with the function of DNA by producing interstrand DNA crosslinks. Cisplatin, it inhibits DNA synthesis by the formation of DNA crosslinks, denatures the double helix, covalently binds to DNA bases, and disrupts DNA function, may also bind to proteins. The cis isomer is 14 times more cytotoxic than the trans isomer. Both forms crosslink DNA, but cisplatin is less likely recognized by the cell enzymes and therefore not repaired. Cisplatin can also bind to adjacent guanines on the same strand of DNA, producing intra-strand cross-linking and breakage. Oxaliplatin, a platinum derivative, is an alkylating agent following intracellular hydrolysis. The platinum compound binds to DNA forming crosslinks, which inhibit DNA replication and transcription, resulting in cell death. In this slide, we can find the chemical structure of the 3 US FDA approved platinum compounds, which are cisplatin, carboplatin, oxaliplatin, combined with another 3 non-US FDA approved platinum compound, which are nadaplatin, it is only approved in Japan, heptaplatin, which is available in Korea. Lobaplatin can be viewed as a derivative of heptaplatin, initially developed by AstraZeneca in Germany. Its regulatory approval was only obtained in China. We should actually remember together the meaning of bilocalcium and the meaning of intercalation to fully understand anticancer antibiotics as a cell cycle non-specific chemotherapeutic agents. Bilocalcium is relating to the renal pelvis and calyces system. The renal calyces are conduits in the kidney through which urine passes. When it comes to the intercalation, which is defined as the insertion of molecules between the planar bases of the oxyribonucleic acid. Now we're gonna start to discuss the first 2 anti-cancer antibiotics out of 8 members that we're gonna pour over in this presentation. First is bleomycin, which inhibits synthesis of DNA, binds to DNA leading to single and double strand breaks, also inhibits to a lesser degree RNA and protein synthesis. As you can see in the picture here, DNA bleomycin ferrous complex is converted to DNA bleomycin ferric complex, yielding superoxide and hydroxyl radicals cause DNA strand breakage. Second is dactinomycin, which binds to guanine portion of DNA, intercalating between guanine and cytosine base pairs, inhibiting DNA and RNA synthesis and protein synthesis. When it comes to mitomycin as anticancer antibiotic, cell cycle non-specific chemotherapeutic agent, We have three pharmaceutical dosage forms for mitomycin. Dosage forms for mitomycin, which can be listed as follows. Mitomycin systemic alkylates DNA to produce DNA crosslinking, primary with guanine and cytosine pairs, and inhibits DNA and RNA synthesis. Mitomycin is not cell cycle specific but has its maximum effect against cells in late G and early S phases. Mitomycin ophthalmic during use in trabeculectomy filtration surgery for glaucoma. Mitomycin topical ophthalmic application alters conjunctival vascular endothelium and inhibits fibroblast proliferation, which is one of major complications of the filtration surgery. Mitomycin urethral gel. Following installation into the pilocalcium system, mitomycin urethral gel forms a semi-solid gel that dissolves from normal kidney urine flow, releasing mitomycin. To fully understand the anticancer antibiotic, we have to remember topoisomerase 1 and 2 and their effects on the DNA. Topoisomerase 1 is an essential enzyme for normal development. Its major function is to relax supercoiled DNA and alleviate the DNA helical constraints. When it comes to the topoisomerase 2, which is an enzyme that is able to break and rejoin double-strand DNA molecules. In this way, it can control the topological state of the DNA. In the next 5 slides, we're gonna learn extraordinary information about the third anti-cancer antibiotic. The third anti-cancer antibiotic, doxorubicin. Doxorubicin participates in a wide range of free radical reactions. The drug can undergo one electron reduction to the corresponding semiquinone, leading to the generation of superoxide and hydrogen peroxide. Additionally, the drug causes the disappearance of cardiac glutathione peroxidase, leaving the heart with no means of disposing of the hydrogen peroxide, thus generated leaving the heart with no means of disposing of hydrogen peroxide, thus generated, leading to cardiac toxicity. Doxyl liposomes retain the drug payload during circulation and accumulate preferentially in tissues with increased microvascular permeability, as often is the case of tumors.
Doxyl toxicity profile is drastically different from that of doxorubicin
and is characterized by dominant and dose-limiting mucocutaneous toxicity, mild myelosuppression, minimal alopecia, and no apparent cardiac toxicity. As you can see, doxorubicin interacts with molecular oxygen, producing superoxide ions and hydrogen peroxide, which cause single-strand breaks in DNA. Conventional systemic doxorubicin, adriamycin. It inhibits DNA and RNA synthesis by intercalation between DNA base pairs and by inhibition of topoisomerase 2 and by steric obstruction. Doxorubicin intercalates at points of local uncoiling of the double helix. Although the exact mechanism is unclear of the doxorubicin, it appears that direct binding to DNA intercalation and inhibition of DNA repair to topoisomerase 2 inhibition result in blockade of DNA and RNA synthesis and fragmentation of DNA. When it comes to the liposomal doxorubicin, which is also a powerful iron chelator, the iron doxorubicin complex can bind DNA and cell membranes and produce free radicals that immediately cleave the DNA and the cell membranes. Doxorubicin inhibits DNA and RNA synthesis by intercalating between DNA base pairs, causing steric obstruction, and inhibits topoisomerase 2 at the point of the DNA cleavage. Doxorubicin is a powerful iron chelator, and the iron doxorubicin complex can bind DNA and cell membrane, producing free hydroxyl radicals that cleave DNA and cell membranes. Liposomal doxorubicin is a pegylated formulation which protects the liposomes and thereby increases blood circulation time. Liposomal doxorubicin is doxorubicin contained in tiny spheres called pegylated liposomes. These spheres keep the doxorubicin in the bloodstream longer so that more of the drug reaches the cancer cells. Liposomal anthracyclines. As you can see in the picture, the co-presence of phosphate molecules, hydrophilic head, and fatty acid hydrophobic tails plays an important role in this vesicle phenomenon. The phosphate group interacts with water H2O molecules, while the hydrophobic tails escape from water molecules and interact with each other. Calyx or ductile is a novel pegylated liposomal formulation of the first generation anthracycline doxorubicin. As you can see, the yellow particles of doxorubicin is encapsulated in the liposomal aqueous core. Calyx pegylated liposomal is doxorubicin hydrochloride encapsulated in liposomes with surface-bound methoxypolyethylene glycol (MPEG). This process is known as pegylation and protects the liposomes from detection by the mononuclear phagocyte system (MPS), which increases blood circulation time. Liposomal anthracyclines were developed to decrease the risk of cardiotoxicity experienced with the conventional doxorubicin while preserving the anti-tumor efficacy. Liposomal anthracyclines achieve lower cardiotoxicity by changing tissue distribution and by decreasing rate of drug release. Pegylated liposomes exhibit positive results such as prolonging drug circulation, enhancing circulation in tumors, permeability as well as retention effect, and attenuate side effects. Finally, we should notice that the steric effect of the surface modification of the liposomal nanocarrier with polyethylene glycol chains allows it to avoid the reticuloendothelial system's absorption, prevent the mononuclear phagocyte system from identifying the phagocytosing drugs. Liposomal and the conventional doxorubicin price comparison for the Doxil intravenous each milliliter costs around $79.56 for each 2 mg per milli, compared to only 36 cents to $1.71 as a cost for each milliliter of conventional intravenous doxorubicin with a concentration of 2 mg per ml. In this slide, we will discuss the last 4 anti-cancer antibiotics mechanism of action out of the 8 members in this presentation. Ibaropicin is an anthracycline anti-neoplastic agent known to inhibit DNA and RNA synthesis by steric obstruction after intercalating between DNA base pairs, active throughout entire cell cycle. Intercalation triggers DNA cleavage by topoisomerase 2, resulting in cytocidal activity and generates cytotoxic free radicals. Idaropicin inhibits DNA and RNA synthesis by intercalation between DNA base pairs and by steric obstruction. Although the exact mechanism is unclear, it appears that direct binding to DNA intercalation and inhibition of DNA repair topoisomerase 2 inhibition result in blockage of DNA and RNA synthesis and the fragmentation of DNA. Mitoxantrone is an anthracene-dione which is related to the anthracyclines. Mitoxantrone intercalates into DNA, resulting in crosslinks and strand breaks, binds to nucleic acids, and inhibits DNA and RNA synthesis by template disordering and steric obstruction. Replication is decreased by binding to DNA topoisomerase 2 and may inhibit the incorporation of uridine into RNA and thymidine into DNA. Mitoxantrone is active throughout entire cell cycle as cell cycle non-specific chemotherapeutic agent. Daunorubicin inhibits DNA and RNA synthesis by intercalation between DNA base pairs and by steric obstruction. Daunorubicin intercalates at points of local uncoiling of the double helix. Although the exact mechanism is unclear, it appears that direct binding to DNA intercalation and inhibition of DNA repair topoisomerase 2 inhibition result in blockage of DNA and RNA synthesis and the fragmentation of DNA. Antimetabolites S phase. Cabazidabine, fluorouracil. Mechanism of action: pyrimidine analog, inhibits thymidylate synthase, which depletes thymidine needed for DNA and RNA synthesis. Cabazidabine is an oral prodrug of 5-FU, fluoxuridine, analog of 5-fluorouracil. Gemcitabine and cytarabine, pyrimidine analog, which inhibits DNA polymerase and causes chain termination, causes DNA breakage. Fludarabine, adenosine analog, which inhibits DNA polymerase when incorporated into DNA, causes DNA breakage. Methotrexate, folate analog and inhibits dihydrofolate reductase, depletes purine and thymidine nucleotides necessary for DNA synthesis. Leucovorin folinic acid used for reversal of methotrexate toxicity and as a part of chemotherapy regimens. Hydroxyurea inhibits ribonucleotide reductase necessary for DNA synthesis. Cladribine, adenosine analog, causes DNA breakage. Azathioprine, 6-mercaptopurine, 6-thioguanine, inhibits purine nucleotide synthesis.
In the next 8 slides, we can eventually briefly summarize with a clear illustration of 28 cell cycle non-specific chemotherapeutic agents mechanism of action. Busulfan reacts with the N7 position of guanosine. Triosulfan, the epoxides alkylate and crosslink DNA. Carmustin, alkylation and cross-linking the strands of DNA, carbamylation of amino acids in protein. Analog. Bendamustine, nitrogen mastered derivative, purine analog. Lomastine, alkylation and carbamylation of DNA and RNA. Stromastine, anti-androgen effects due to estradiol, anti-microtubule effects due to non-nitrogen mastered. Cyclophosphamide, alkylation cross-linking DNA. Ifosfamide, alkylation cross-linking DNA. Mesna, chemoprotective, uroprotective, and neuroprotective agent. Lurbinectidine, inhibition of oncogenic transcription results in tumor cell apoptosis. Procarbazine, inhibiting transmethylation of methionine into transfer RNA, may also damage DNA directly through alkylation. Mechlorethamine, nitrogen mastered alkylating agent which forms inter- and intrastrand DNA crosslinks. Melphalan, that inhibits DNA and RNA synthesis via formation of carbonium ions crosslinks strands of DNA. Melphalan flofenamide, peptide drug conjugate, enzymatically hydrolyzed to the alkylating agent melphalan. Dacarbazine, active alkylating metabolite MTC, alkylation methylation of DNA at the O6N7 guanine positions. Temozolomide, a prodrug converted to MTIC. Streptozocin, alkylation and cross-linking the strands of DNA. Thiotepa, an alkylating agent which produces cross-linking of DNA strands. Chlorambucil, interferes with DNA replication and RNA transcription by alkylation. Altritamine, metabolites from crosslinks with DNA and RNA. Carboplatin covalently binds to DNA. Cisplatin, DNA crosslinks, denatures the double helix. Oxaliplatin binds to DNA forming crosslinks which inhibit DNA replication and transcription. Bleomycin binds to DNA leading to a single and double strand breaks. Dactinomycin, intercalating between guanine and cytosine base pairs, inhibiting DNA and RNA synthesis. Mitomycin systemic alkylates DNA to produce DNA cross-linking primary with guanine and cytosine pairs. Mitomycin ophthalmic, mitomycin urethral gel. Doxorubicin adriamycin systemic inhibits DNA and RNA synthesis by intercalation between DNA base pairs and by inhibition of topoisomerase 2 and by steric obstruction. Liposomal doxorubicin adriamycin. Iberubicin inhibits DNA and RNA synthesis by steric obstruction after intercalating between DNA base pairs. Idarubicin It appears that direct binding to DNA intercalation and inhibition of DNA repair topoisomerase 2 inhibition, mitoxantrone. Replication is decreased by binding to DNA topoisomerase 2 and may inhibit the incorporation of uridine into RNA and thymidine into DNA. Daunorubicin inhibits DNA and RNA synthesis by intercalation between DNA base pairs and by steric obstruction.